My name is Claus
Bodewig and I'm 45 years old. I'm retired now and I got diabetes 20 years ago. It just happened overnight. I went into hospital, the diagnosis was diabetes and a new chapter opened up for me in my life. First of all, huge alteration from old habits to new habits. However, in doing that, I neglected to deal with diabetes thoroughly, and I'm experiencing the consequences of that now. Because I severely underestimated the possible effects of diabetes.
The
problem was that I had to totally restructure my working environment. Imagine a rep out on the road who used to eat and drink what he wanted without a second thought, then suddenly having to restructure his day, and the first thing he asks himself in the morning is, what do I want today, and when, and what do I eat? I must say the instruction 20-25 years ago was nowhere near as effective as today, with the result that my glucose was up and down like a roller coaster. And each time your glucose jumps like that, it affects your retina. My retina bled. I've had 7 eye operations in the last 8 weeks, with the result that it is stabilized but can't be improved. I have to live with it, and you can live with it. And since then, I've become aware of the diabetes, because of the change in approach and also the resultant modifications.
We met 16 years ago, and now we're in our 4th year of marriage. He had diabetes when I met him. He had fluctuations from 20 to above 1,200 one time, and nobody could understand it. For many years, every doctor told us, yes, that's your problem. You are one of the few patients for whom regulation does not work. And that's the reason for all these long-term consequences, the polyneuropathy that he has, the problem with his eyes. And there are a great many other things too. His kidneys don't work properly, his liver doesn't work properly, but you learn to live with it. I've become far more calm since he got the pump.
Now, after having the pump for 6 months and consistently adopting the checking system, there have been no stays in hospital, no emergency doctor, no emergency visits, just a relatively normal life, which is more fun and good for the relationship, and my wife doesn't need to call twice a day to check whether I'm lying in a corner somewhere.
Having this assurance that there is a device which supports you, and now seeing as the pump goes off at 90, he does a check and sees, right, I'm still at 70 or I'm right down to 40, but you still have the time to think and get a drink or make something to eat, and that is a great reassurance for me. I must say, since he's had the pump, he can eat what he wants. He just adds a bit, especially now with checking and warning signals he gets. Quite often it doesn't wake him in the night, but it wakes me.
Why do you fight for your life? Because your own life means something to you. And it's not just your own life that's important. And if you're fortunate enough to find a partner who's prepared to go through all this bother, then you really have to count yourself lucky. And then I reckon the partner at least deserves to get something back. And I mean every day. I'm of the opinion that I don't always have to understand everything, but I have to get the best I can for myself. And every day it's a new challenge. Each night I have no idea whether I'll wake up the next morning and be able to see anything. And when the next morning comes along and I open my eyes and I actually see something, then it gives me satisfaction. The children have grown up realizing that lightness and dark are always very close to one another. And as a result, they don't get worked up about the things that normal young people do, whether it's forgetting a cigarette or if someone has a go at you. And most people couldn't understand the calm manner in which they deal with things like that, to be so worldly wise. But at the end of the day, it strengthened them on the one hand, but they've had a lot to deal with, I have to say. There hasn't been much lightheartedness.
If somebody new gets diabetes, I would advise every partner to take the instruction offered from the start, because it really reduces the fear factor. In the beginning, I was always afraid he might not wake up in the morning because of hypoglycemia. That was actually my greatest fear, and I was told that nothing can happen. If you have hypoglycemia, unless you've had alcohol beforehand, then he could die of that. But normally, if he hasn't been drinking alcohol, he could have the worst hypoglycemia and the liver would have sufficient and he would wake up again.
Yes, if somebody gets diabetes, he should really do two things. The first is to do the training and, if possible, include the partner. To examine your own life and say, this and that happens. And if you've got diabetes, you should always have something in your pocket that shows that you've got diabetes. There's a nice ID. You see, the problem is, when you've got hypoglycemia, you sometimes behave as though you're drunk from alcohol. And a person without diabetes can't tell the difference. But if you have a piece of paper in your hand which says, I have diabetes, I need sugar, I need something to eat now, then people are more likely to listen. I can only advise people to really look into it seriously and draw the consequences too.